I entitled this talk The Ultra Invisible because it's a term that I heard from a community partner that has stuck with me for years. I'll tell you a little bit more about her and about this idea, but really wanted to bring things down by talking about death before 10 a.m. here. So first, I'd like to get an idea of who I'm talking to. So how many of you have been touched by dementia? If you'd be able to throw up a hand, maybe you knew someone who had it. And could you just keep your hands up for a second? I promise I'll be quick. Maybe you cared for someone. Keep your hands up. Everybody who's raised their hands so far, keep them up. Or maybe you knew someone who cared for someone with dementia. So if you look around the room right now, most people have their hands raised. Dementia is going to touch your life at some point. So real quick, let's talk about what dementia is. Dementia is kind of this umbrella term, this idea, well, it can be caused by a lot of things, but what I'm talking about today is how frequently we see these different diseases that cause dementia. It's a little bit confusing because in reality, it's way less likely that someone's just gonna have one cause. So really not close to these 50% figures for just having Alzheimer's. Instead, it would be more common to maybe have Alzheimer's and vascular dementia. And then the other thing you'll see here is a map. And what this map reflects is predicted increases in dementia. So basically darker means a greater increase. And you'll notice that Arizona is as dark as it gets. In fact, Arizona is #1 in the country for projected increase in experience of dementia. We're somewhere in the range of 6 million people in the US have dementia and are cared for by 11 million family and friends, folks who are just helping them out, often without any kind of pay. I have a lot of colleagues who study folks with dementia. The thing that I do that's a little different from them is I think about these folks who cared for someone with dementia after a death happens. I'm gonna talk again about that ultra invisibility in a second, but it's those former caregivers that I think of as the ultra invisible. This million figure is some back of the napkin math suggesting that every single year in the US, we might have as many as 1 million new bereaved dementia caregivers. It's a lot of people. And 25% of them might get this kind of grief that is not the grief we feel when we experience a loss or experience a death. Instead, it's this kind of grief that impairs almost every aspect of our life. It impairs the way we interact with our kids or do our jobs. It really takes away from us. And it lasts and lasts longer than we'd expect based on our religious norms or our cultural norms or our social norms. And what's really weird about this bereaved dementia context is this might be 2.5 times the rates of other chronic care contexts, things like somebody who cared for someone with cancer. 25% of those million people every year are experiencing this clinically pathological grief. 250,000 people, right? That's a public health crisis. But even for those other 750,000, right? So these other 3 people in this picture down here, there's reductions in satisfaction with life and positive affect. There's people struggling to get through some depressive symptoms that don't quite hit a disorder but don't feel very good. My goal as a researcher, the thing I want to do when I look back on a 40-year career is I want to say that a former caregiver they know exactly where to turn. They know where to find tools or resources to help them not experience these difficulties. Right now, it's pretty hard to know where to turn. I want to be really clear. I'm not here to tell people don't feel sad when someone you care about dies. I'm not even here to say don't grieve when someone you care about dies, because I think it's probably adaptive to feel sad and to grieve, but I don't want people to feel this clinical grief. I view it as my mission to help them not have to experience this clinical grief. And I want to help them have more of that positive affect or satisfaction with life. And I want to help them bounce back from maybe some of those subclinical depressive symptoms. Okay, so I told you these big numbers, but I think that's super impersonal, and I'm a community engaged researcher. I get to work with lots of community partners, so let me tell you about Cheryl. Cheryl's one of my first community partners I ever created a partnership with. Just saw her on Tuesday. She deserves a huge share of the responsibility for why I do the work I do. Cheryl talked about the invisibility of caregiving, and then when caregiving was over, she felt ultra invisible. I'll explain that in a second. Cheryl was a senior project manager for a Fortune 500 corporation. She was doing information technology stuff around the transition to Y2K. For anybody who isn't familiar with Y2K, go read the Wikipedia page. We were pretty scared about it. A little bit after that, a couple years, she took a couple months off. Her mom was having heart surgery, needed some help with recovery. Those couple of months turned into a decade in which she took care of her mom, who eventually developed dementia, took care of her dad, took care of her husband's mom, and took care of her husband's dad, who also developed dementia. So 4 parents, took care of them for a decade. Then in the course of 14 months, all 4 of them died. She lost the entire generation above her. Cheryl struggled with this, right? She had a really difficult time with this because, as she put it, she was a dinosaur in the IT world, right? A decade. She's been gone. She's not going back to that. She was a damn good caregiver. She was a very good caregiver, right? She was really good at this, but the whole generation above her is dead. There's nobody to care for anymore. So who is she? She talked about this invisibility when she was a caregiver. She talked about how most of the time it was all about the parents she was taking care of, right? But occasionally you'd get a really nice nurse who was like, Cheryl, how you doing? You know, check in on her. Once all those parents died, nobody checked in. Nobody cared. Nobody thought about, oh, Cheryl could have needs, because the people she was taking care of, they died. My job is to make sure that Cheryl doesn't feel like that Cheryl knows where to go, that Cheryl can get the supports she needs when she's struggling through that. I talk to a lot of people about the kind of work I do, and I tell them all the time about this lack of resources. Feel free to take a picture. If you know someone with dementia, which a lot of you folks raised your hands, you're probably going to know somebody who is a bereaved caregiver at some point. I have checked with all of these societies and associations. They're willing to talk to and help folks after those deaths, help connect them with resources. And the National Suicide Prevention Hotline is there at the top because sometimes people are in such acute difficulties that they need that kind of help right away. The goal here is to have a wide range of resources. I also threw my website up there. On the website, we have these resources, but we have other things too. We have books. We have, hopefully soon, we'll have places to find a wider range of support groups. A whole bunch of different resources in a kind of different strokes for different folks kind of attitude. My email's up there if you want to talk. I spend a lot of my time trying to understand these former caregivers so I can improve their lives. If you want to get involved in our research, there's a QR code or an email address that you can reach out to there. And finally, if you know a current or a former caregiver, the last thing I'd like you to leave here with, the thing that I'd like you to remember most from my talk is to reach out to them. Buy them a cup of coffee. Give them a 15-minute call and just see how they're doing, right? Take them to lunch. They have needs, and I think we can do a lot to support them, and I hope you will. Thank you.